All right, Drew, thank you. Wisconsin health officials are launching a new tool for responding to overdoses. It will provide real-time data about when and where a suspected overdose happened.
CBS 58's AJ Byattpour talked to those working directly to prevent overdose deaths and shows you why they are optimistic about this.
This is why I do it, because when I lived in addiction, I never thought that I could overcome it. I didn't know what resources were available to me.
Tahira Malik now operates Samad's House, a collection of 3 sober living homes for women on Milwaukee's north side. She currently uses Milwaukee County's overdose dashboard to track where overdoses are happening.
Then we know exactly where the highest rates and the highest overdoses are occurring, so we know that we need to be there.
That allows the group and its partners to have weekly pop-up resource fairs where there have been recent overdoses.
We're talking about NARCAN, we're talking about fentanyl testing strips, we're talking about hygiene items, we're talking about food.
Thursday, the Wisconsin Department of Health Services says it is going one step further. The DHS is launching its own tracker, Wisconsin Suspected Overdose Alerts for Rapid Response, called WeSOAR. It will give partners real-time access to info about ambulance calls and emergency room visits for suspected overdoses.
That's new. So in a new way that partners can collect data on overdoses to inform their work on the front lines in the communities.
Those partners are excited to have another tool. Racine County Behavioral Health Services tells us, quote, with access to real-time data from WeSOAR, Racine County can more effectively identify underserved areas and strategically direct resources where they're most needed. Those on the front lines are already encouraged because overdoses have declined in many parts of the state this year. After more than 650 overdose deaths in each of the last 2 years, Milwaukee County reports fewer than 300 deaths as of early September. Kenosha County reports 24 toxicity deaths after having 58 in both 2022 and 2023. Malik says now having info about hospital visits will allow helpers to reach people more quickly.
So if someone is able to actually not pass from that drug overdose, being there to say, hey, are you ready for treatment? Because now we know where to go.
Now, the new DHS tracker will not be available to the public. Local government agencies and those providing substance abuse treatment will have access. Jessup and Natalie, they'll then be able to customize alerts for what they believe constitutes an overdose spike in their areas.